So, this next question is about a young child, a 2-year-old, who had surgery to correct an eye turn. And the parent is asking about how to help get the two eyes to work together. So, eye teaming activities require good stereopsis or a good alignment. So, a lot of eye hand type work is very helpful. So, going for stacking blocks, puzzles, putting objects in containers. The other thing that's important is the vestibular system is very much involved in developing the binocular system. So, doing spinning, there's you want to spin it in certain directions depending on which eye is turning, but just in general, it's good to spin on a slow moving chair. Also, doing activities where you're moving them forwards and backwards and tilting them side to side. All of those can help develop that vestibular and visual system, as well as aiming type games like tossing a ball or hitting a ball on a string. As I mentioned, putting things on top of each other, so stacking type things, stacking cups, nesting cups are all great. Um, the other question about this individual was sometimes the child wants to take his glasses off, and that's actually happens much more often than we realize. What happens is with glasses, and particularly if you're using the full prescription, it's giving maximum visual input, but sometimes that's overwhelming, especially if the child's tired or there's a lot of demand on that visual system. So it does help to actually take breaks from the glasses. I often employ therapy prescriptions. So they'll have one prescription for school for the intense focus, and then maybe a weaker prescription, say a prescription that I want to work them towards. So very often I've been able to reduce prescriptions. So we might have what we call a therapy prescription that has prism in it that actually helps with the eye alignment, and then the child will end up moving towards that prescription. I'm also not a huge fan of patching because patching actually makes it harder for the two eyes to work together. Initially, if there's a huge difference between the eyes, it has been used, but if the acuity is pretty equal between the two eyes, I actually don't patch because that disrupts the development of binocular skills. So instead, we'll use Polaroid glasses or anaglyphs, which are red and green glasses with red-green activities. There is a company, redgreentoybox.com. They actually had a lot of good games for little kids. Our Visual Brain is another program that has a lot of good activities for younger kids to develop that binocular skill. As always, it makes sense to just check with an optometrist or ophthalmologist, but ideally an optometrist that does do vision therapy or vision rehab to gain insight as to what's the best prescription and what's the best course of treatment. Again, the other thing that's very interesting is it depends on how fatigued they are, what's going on, what the demands are. So remember, vision's very dynamic. So it's really best to check with an eye care professional that understands vision, vision function, and vision development to determine what's the best way to work with an individual and what's the best way to improve those visual skills. And certainly any type of activity that works with eye-hand coordination, and as I mentioned, puzzles, stacking blocks, all of that in the very early years is really, really important.